Hello, I'm Dr. Gentile, and these are your tips on psychological first aid when talking to persons with intellectual disability. Many persons with ID experience trauma, and we should be aware of best practices in how to provide support and navigate conversations. Just as there is first aid for physical health problems, there are many things that you can do in your supporting role to provide psychological first aid, not only after a person with ID has experienced trauma, but really during any discussion, whether or not it is related to trauma. Here are some guidelines. Model healthy responses. Be calm, courteous, organized, and helpful. Remain within the scope of your expertise in your designated role. Be knowledgeable and sensitive to culture and diversity. Pay attention to your own emotional and physical reactions and practice self-care. When communicating through a translator or interpreter, it's important to look at and talk to the person you're addressing rather than the translator or interpreter. Remember, the goal of psychological first aid is to reduce distress, assist with current needs, and promote adaptive functioning, not to elicit details of traumatic experiences and losses. When you're unsure of how to help, ask questions such as, "What can I do to help?" or "What do you need right now?" What are some behaviors to avoid in these situations? First, don't assume that everyone exposed to trauma will be visibly upset. Don't focus on one person's helplessness, mistakes, or disability. Focus instead on what the person has done that is effective, or what they may have contributed to helping others in need. Don't assume that all survivors of trauma want to talk or need to talk to you. Often, just being physically present in a supportive and calm way helps affected people feel safer and more able to cope. Finally, you can make a significant connection with persons who have been exposed to trauma. Remember, DODD is committed to supporting individuals with ID, as well as their families, caregivers, and treatment teams. Please visit dodd.ohio.gov to access these tips on psychological first aid and many other resources today. I'm Dr. Gentile. Thanks for listening to these tips on psychological first aid for persons with intellectual disability. Be well.